This disorder is called Marfan syndrome. What is Marfan syndrome? Marfan syndrome is a disorder of the connective tissue that strengthens the body's structure. Marfan syndrome was discovered by Antoine Marfan in 1896. Antoine Marfan had a 5-year-old patient, and he noticed that she was very thin, had long arms, and abnormally long fingers and toes. He began to also notice that many of his other patients came to him with the same symptoms, and they had the same appearance too. They were tall, thin, long, with narrow faces, a curved spine, with protruding or sunken breastbones.
I had people looking at me from all sorts of angles. Since I was pretty small, so I'm pretty used to, being in the spotlight a lot. They diagnosed me with Marfan syndrome.
When you were younger, did you change in your size or your length from other children?
It was very long, very, very long and thin, which was I was always a curiosity for people. I was a very thin person, and I might have been like the length of other people, but it just made me look thinner because of the way my bone structure is.
Are your joints particularly flexible?
Yes, very flexible. That's always been a fascination of a lot of doctors.
Yeah? How far back can you go?
This is pretty much as far as I can go.
Any other fingers?
Uh,
How about your wrist?
I was pretty small, about between 6 and 7. My regular physician, she noticed a little murmur in my heart, and I went to a heart specialist. And from there, I went to specialist after specialist, to heart, limbs. I've seen a number of specialists. I've always been looked at all the time. I guess I'm really used to that. I've always been being in the spotlight and just being asked questions about my hands and my bone structure and stuff.
What causes Marfan syndrome? Marfan syndrome is caused by a mutation of the gene called fibrillin-1. This gene plays an important role as the building block for elastic tissue in the body. Is it sex-linked? No. Remember, it is a syndrome of the connective tissue. Is it autosomal? Marfan syndrome is an autosomal dominant disorder, meaning if an individual carries an abnormal gene for Marfan syndrome, that individual has a 50% chance of giving their child the disorder too. It's a mutation, alright. Of the gene called fibrillin-1, a protein found in humans. Signs and symptoms. They include nearsightedness, flat feet, crowded teeth, a curved spine that usually curves to one side, flexible joints, learning disabilities, very long limbs, and a thin face, especially the jaw. Treating Marfan syndrome. There is no cure. However, you can have surgeries done, Receive an orthopedic brace to limit damage and disfiguration. Show up to regular eye exams. Regular checkups for your heart, lungs, and blood vessels. Take visits to a cardiologist who specializes in hearts. Visits to an orthopedist who specializes in bones. And an ophthalmologist who specializes in eyes. Medicine is taken for pain. How is Marfan syndrome diagnosed? There are no tests to diagnose Marfan syndrome. A genetist, a doctor with special knowledge about inherited diseases, must observe you and be informed of your medical history. A patient with no family history of the disease must have at least 3 bodily systems affected before they can be actually diagnosed, such as abnormal bone growth in length or recent heart troubles. Is Marfan syndrome lethal? Yes. Marfan syndrome can cause the aortic root, which is the largest blood vessel that comes from the heart, to weaken and tear. The lifespan for people with Marfan syndrome is merely 61 years of age. 1 in 5 people in the U.S. are born with Marfan syndrome. And that concludes my presentation.